Safety checks every RN should perform at the start of their shift. Number one, your patient. You have to check your patient at the start of your shift, or let's say after taking a report from the outgoing one. Check your patient to confirm that you got a live patient. Observe their speech while you interact with them. Also assess their orientation while doing that. The second one is oxygen. You check to confirm that the oxygen in the patient's room has an oxygen gauge connected to it, and there's an oxygen delivery device, just like the nasal cannula, available in the patient's room. If the patient is on oxygen, you verify how many liters the patient has running, if it's the same as what was mentioned during report. You also check for the ambu bag, if it's present in the room or is it in the hallway. I know some hospitals put their ambu bags in the hallway, while for unit specific reasons, some put in the patient room. Verify that there's an ambu bag. Verify that the PEEP valve is also available in the patient's room. The next is the patient's bed. You ensure that the bed is at the lowest position possible. Why is this? It minimizes the risk of falls in patients with high fall risk. Even one that has low or minimal fall risk may fall if they are in an elevated bed without knowing. So we have to make sure that the bed is at the lowest position. And even if a patient falls from a low level, the likelihood of getting injuries from that fall is minimal or even zero. Next, if your patient has a tracheostomy, you have to make sure that there is an obturator present in the patient's room. Next, you have to make sure that there is a tracheostomy kit or set in the patient's room. One should be the same size as whatever the patient has on, and the other one should be one size below what the patient has on. You also have to ensure that your suction is connected and is working. You also have to ensure that you have the tracheostomy suction catheters available in your patient's room, so that when there is need to suction a patient, you won't be running helter-skelter to look for that. You can just pick from whatever is available and use it. The fifth one is drips. Drips can be medication that is running to the patient. It can be IV fluid. It can be a cardiac drip. It can be a heparin drip. It can be anything. Whatever is running to the patient is what is classified under drips. And you check it in stages. One, you check the bag. You look at the bag, look at whatever is running, pull up your patient medication list, verify that whatever is ordered is the same thing that is running to your patient. The next thing is to check your pump. How many meals an hour is running? Is this fluid or medication running at? You verify that, verify the dosage, that whatever is running corresponds to what was ordered for this patient. The next thing is the tubing. You look at the tubing, checking for if the tubing is expired. If not, you proceed to trace the tubing from the pump to your patient and back to the pump from the patient. So when you tracing it to the patient, ensures that whatever patient is getting or whatever infusion or medication is running is actually getting to the patient, because sometimes the tubing may not be connected to the patient, or it may have accidentally be pulled out, and the medication will just be delivering whatever content it has on the patient's bed, and then you find out that the patient is soaked with medication or fluid or whatever. When you trace it to your patient, you're also able to observe the IV site. Observing the IV site for infiltration, extravasation, or swelling or kinking at the site, or anything, or even bleeding. So doing that, gives you an opportunity to make sure everything is perfect at that site. Then you trace it back to the pump. This ensures that the patient is getting whatever medication is ordered to them. That will be all for this video. If this video was beneficial to you, do well to like, subscribe, so that you can get notification whenever I post a new video and also share with your friends. If you are new to this channel, my name is Eudora. I'm a Nigerian trained nurse, but I'm currently working in the US as a bedside nurse. And on this channel, I share content to help international nurses like myself integrate into the healthcare system and practice safely. Bye.